head injury. So maybe head injury is there, maybe some kind of operation of the some kind of that cyst was in the brain and or something like that. कुछ ऐसा हुआ है. They have the background that they were having some memory problems and something. They are not oriented with the time test person. For those, these are the tests is being conducted, whether the Mendel Gestalt test or MMPT test. So now I am going to tell you about this. What is the test? Is a mini mental status examination, right? So mini mental status examination में क्या क्या चीजें पूछनी होती हैं? So there are the part 1 and part 2. So part 1 is my ample. Although I have remembrance, but still I am telling with this so that I can tell you the right thing. So number 1 is a part 1. Part 1 there's a 5 items are there. So number 1 item is where you have to ask the patient name of themselves. उनका नाम क्या है? Name, day. What is the day is today? Which year is this? And the season as well as the month also. So there are the 5 things. What is the name? What is the day? What is the month? What is the season? And number 5 is month. So there are the 5 items. So 5 questions, 5 items, and out of 5 the patient is like getting all 5 scores. It means that the patient's orientation is completely intact, right? If the patient is not able to like identify or associate with all 5 factors, it means the patient has some problems. So when we are doing with the above the age of 60 years, of course they are having some issues and the problems. अभी जितने भी ECG wards में है patients, so where you can conduct these other tests, and those who are chronic schizophrenic, उनके ऊपर भी ये test आप कर सकते हैं. And number 2 item, ask the patient to name of the state, country, town, hospital, and floor. There are again 5 items, 5 questions. Which town they are here, and which state, which country, and whether their hospital or the restaurant, wherever is this, they have to tell about, and the floor, the ground floor, the first floor, the second floor, where the patient is, they should aware about the floor also. So number 2 is also composing of 5 questions. Number 3, ask the patient to repeat 3 unrelated objects that you name for him and have to repeat them right after you tell them. So unrelated objects, 3 unrelated objects. So what could be the unrelated objects? क्या हो सकते हैं unrelated objects? पेड़, हाथी, औरत, हो गए ना? Unrelated हो गए ना? तो unrelated objects कोई भी, जैसे तो अभी तो मैंने एक example दिया, you can say anything. So 3 unrelated objects, you have to speak them, and just afterwards you have to just ask. Now you have to tell what the objects we have told. And number 4 is have the patient subtract 7 from 100. Subtraction 7 from 100. 7 from 100. Out of 100 you have to say that subtract 7, then 7, then 7. Suppose 100 is there, 100 number is there. Subtract 7. So what would be? 93. And 93 again 7. 86. 87 again have to subtract 7. 77. So same thing, like 17 or 89. So that way the patient at least 5 consecutive trial have to get. 5 तक आपको उसको लेकर आना है. Tell 5. And number 5. Number 5, ask the patient to repeat or 3 related objects. Now that was the unrelated objects. Now 3 related objects. Related objects में जैसे कौन-कौन से related objects हो सकते हैं? Classroom, table, and chair. All are related objects. The patient are going to tell about just after this. So three scores you have to give. And that have the patient subtraction of 7 from 100. वहाँ पे आपको 5 देने हैं, because 5 आपको 12 देने हैं, तो 5 scores देने हैं. यहाँ पर आपको 3 scores देने हैं. Now part 1 is over, and now part 2. Part 2, there is a composing of 1. That is a 1 item. Show the patient a wristwatch and ask him what it is. Repeat this for a pencil or maybe for pencil also. So wristwatch you have to show it, and then आपको पूछना है ये क्या है. Same thing you have to show pencil and or लिखा हुआ है. अगर wristwatch नहीं कर पाता है, pencil दिखाना है, उससे पूछना है ये क्या है. This is the 1 score. You have to give 1 score, not 1 score, 2 points. You have to give 2 points. Repeat this for a pencil also. Means there the both are the question you have to ask. Wristwatch भी करना है और pencil भी दिखाना है. That is what we are saying. 2 scores आपको देने हैं. Number 2 is ask the patient to repeat this phrase नो इफ्स एंड्स और बट्स. दिस इज अ फ्रेज. फ्रेज को लिख लीजिए. नो, NO नो, ITS इट्स, कॉमा, ANDS एंड्स, OR BUTS बट्स. नो, नॉट, ITS नहीं है, IFS है. नो इफ्स एंड्स और बट्स. दिस इज द फ्रेज. So that phrase has to repeat. This phrase has to repeat, and if the correct repetition is there, then 1 point you have to give. And number 3, have the patient follow 3-point commands such as to take a paper in a right hand and fold it and do half it, and then keep it on the floor. So like this is the paper, and half the paper you have to fold it, and after folding, like it, keep it on the take in the right hand, then fold it, and then keep it on the floor. And this is what you have to show it, and the patient is going to follow the same instruction, right? So this is the number 4. Now, no, this is the number 3. And number 4, on a blank piece of paper, write the sentence, close your eye. Blank piece of paper and write the sentence, close your eye. This sentence आपको उसको बोलना है, ये लिखो, close your eye, right? उसने close your eye लिखा, and फिर उसे कहना जो लिखा है वो करके दिखाओ. What you have written, and you have to just show it. So in the following the instructions are close your eye. It means understand the meaning of it. So close, he is going to close his eye. Just करके दिखाना. Close your eye, and ask the patient to read it also. And then ask the patient do it also and read it also. So this is the only 1 point we have to take. This is the number 4. Number 5. Give the patient a blank piece of paper and ask him to write a sentence. It must be written spontaneously. Score correctly if it contains a subject and verb and it is a sensible statement. Containing of verb भी होना चाहिए, noun भी होना चाहिए, adjective भी होना चाहिए. One statement